Myself, Dr. Amrita Upadhyay, Senior Lecturer of Department of Prosthodontics, College of Dental Science, BBD University. Today, I will discuss about the artificial teeth selection in complete dentures. These are the content which I am going to cover in this lecture. First is the introduction, objective, pre-extraction record, selection of tooth size, form, tooth color and material summary and first, we will start with the introduction. Treatment for the completely edentulous patient have been described as a combination of three. First is function, comfort, and aesthetic. Despite the fact that the solution of function and comfort problem are often available, but the successfully restoring the appearance of the edentulous patients remains a challenge for the dentist or any kind of practitioner. So, first, we will talk about the objectives in the teeth selection. First objective is the teeth should be in the harmony with the surrounding tissue. That means artificial tooth should not create any problem to the surrounding teeth like mucosa, gingiva, cheek or tongue of the mouth. They should maintain the vertical dimension because if the vertical dimension more or less then it will cause various ill effects to the mucosa bone of the jaw, mucosa of the bone, mucosa of the arch, bone of the arch, or also the TMJ of the patient. They should be efficient for the mastication, as we can say that mastication or chewing of the food is the main function is main function of the denture. So it should be efficient for the mastication. Fourth is the posterior tooth should be selected based on the function, whereas anterior teeth are selected predominantly based on the aesthetic. So whenever we selecting the teeth, we should keep in mind that posterior teeth is mainly for the mastication of chewing of the food and anterior teeth provide aesthetic to the patient. Basically, teeth selection is divided into two parts. First is the anterior teeth selection and second is posterior teeth selection. Today I'm going to discuss about the in today's lecture we are going to discuss about the anterior teeth. So whenever we talk about the anterior teeth selection in a complete denture construction, basically the aesthetically part depends upon the selection of the teeth moreover very importantly on the anterior teeth. So the anterior teeth are primarily selected to satisfy the aesthetic requirement and the posterior teeth are selected to satisfy the masticatory function requirement. So we have to select the teeth in such a way that we can fulfill the patient's aesthetic as well as functional requirement. There are many methods of selection of anterior teeth in which in one of them is the pre-extraction records or guides. Pre-extraction records or guides includes diagnostic cast, photographs, radiographs, observation of teeth of close relatives, and extracted teeth. First, we will talk about the diagnostic cast. Diagnostic cast is most reliable guide for the teeth selection. So, if we have an edentulous patient with pre-extracted diagnostic cast, we can sell pre-extracted diagnostic cast. We can select the size or length of the anterior teeth, and also it will help, and also we can get an idea of arrangement of the teeth from the diagnostic cast. Next is the photograph. Photograph is more accurate than any other guides shows because it shows the natural teeth or at least the incisal edges of the natural teeth. We can ask the patient to have any kind of past photograph which shows the patient smiling, at least some form of teeth are visible, so that it will be helpful to determining the width and height width and outline form of the teeth, and also the shade of the teeth. So most recent photographs before the extraction or loss of the teeth are much valuable for the teeth selection. Next is the radiograph. Intraoral radiograph is very much helpful. It help to determine the size or form of the lost tooth. But radiograph have some disadvantages, like a radiograph are mostly slightly enlarged or short from the original teeth, and sometime it may include any type of distortion. So we can say the radiographic method is not much reliable method for the teeth selection. We can ask patient for extracted tooth, which will help in determining the shape or size of the artificial tooth. But we cannot determine the color of the tooth with the help of the extracted tooth, because the extracted teeth are non-vital. Apart from these, we can also observe any close relatives or photographs of any close relative of the patient, and we will have a fair enough idea of the particular size, shape, color, or arrangement of the artificial tooth of the patient. There are some factors for the selection of the anterior teeth, which may include size of the size, form, color, and material of the tooth. First, we will discuss about the size of the anterior teeth, which includes 7 anatomical entities used as a guide to select the anterior teeth for size. First is the size of the face, second is size of maxillary arch, incisal papilla and canine eminence, or both, or buccal frenum. Fourth is the maxillomandibular relationship, contour of the ridge, and vertical dimension between the ridge, and last is the lip. This method is based on the size of the face. So we can have measure. We can so we here we can measure the average width of the maxillary central incisor would width of the maxillary central incisor would be equal to the bizygomatic width divided by the 16. Bizygomatic width can be measured by the face bow. Face bow can be used as a caliper to record the bizygomatic width of the face. Similarly, the average width of the 6 anterior teeth, that would be bizygomatic width divided by 3.3. The combination of the width of the 6 anterior teeth is slightly less than 1/3 of the bizygomatic width of the face. Bizygomatic width divided by 16 is equal to estimated width of the maxillary central incisors. Bizygomatic width divided by 3.3 is approximate width of the 6 anteriors. That 6 anterior, which include uh, right canine to the left canine. Apart from the width of the anteriors, we can also measure the circumference of the head. Apart from this, the width of the maxillary central incisor can also be measured by the width of the circumference of the head divided by the 13. And the average length of the maxillary incisor is equivalent to the length of the face divided by 20. So length of the face can be measured by the taking a two arbitrary point, one at the hairline and second is at the lowest most prominent part of the chin.